Businesses in the hospitality sector say they had just started recovering from the impact of months of various lockdown restrictions when the sale of alcohol and sit-down services at restaurants was suspended a fortnight ago. It's feared that any extension may render many businesses beyond saving.
While businesses that can have moved to home deliveries of goods, those that cannot, such as liquor stores, wineries and restaurants, will again bear the brunt of any extension of level 4 restrictions. Many that have closed already will most probably never reopen, and that means a tragic loss of jobs that our economy desperately needs. It is time the government gave equal weight to the ill effects of the virus on jobs and tax revenues compared with the stresses suffered by the medical services.
The jewel in Cape Town's tourism crown says the expedited rollout of vaccines and not further restrictions is key to stabilising the economy.
The waterfront has lost a great deal of business. About 40% of visitors that come through the waterfront are visitors outside of Cape Town, the Western Cape, coming in from Gauteng, the rest of the continent, as well as international. And so the hope is that we do not have an extended lockdown any longer than is necessary. But at the same time, that's countered by the opportunities to get the most of the working population vaccinated so the country can continue to open up, to match up to the rest of the world and encourage visitors back to Cape Town.
The Federated Hospitality Association of Southern Africa says continued lockdowns are creating a pandemic of poverty.
The only solution is to get mass vaccinations out on a level never seen before. It should be done like an emergency military operation, where things are achieved in a fraction of the time it normally would. This can be done if government allows business to be part of the plan and rollout. Business is ready and able to lead and implement. It can be done. As FedHasa, we implore government to involve business in an emergency plan that will make this happen for our country.
With over 28,000 active cases, the Western Cape is now firmly in the grips of the third wave of COVID-19. Some 2,400 people are currently hospitalised.
We expect to reach the capacity in the Western Cape public sector hospitals in about 3 weeks' time. We currently have 2,394 designated COVID beds in the public sector in the province. This includes 664 field hospital beds. Of the 664 field hospital beds, 440 are already opened, and of the 440, the average occupancy in those 440 beds is around 45%.
Just over 618,000 vaccine doses have been administered in the province to date, with the goal of reaching 3.5 million by November. Vanessa Puna, SABC News, Cape Town.